and Brad, the two most famous physical therapists on the internet.
All right, hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
And our opinion, of course,
I
Bob.
just got my flu shot, Brad, so don't hit me in my left arm today.
Oh, stick to the right arm?
Stick to the right arm.
Right.
Now. Okay, today, Brad, we're going to talk about 10 big lies and myths about back pain. These are ones that Brad and I commonly hear patients talk about, and they have this certain thought process. And I think it gets in the way of them healing like it should.
Oh,
I mean,
yeah.
You know, psychologically.
Yep, that's a big component of good health.
Right. And by the way, if you are new to our channel, please take a second to subscribe to us.
Oh, there are a few people out there, Bob. Good eye.
All right. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, go over to Facebook and like us. Over the next couple of weeks, we're giving stuff away, I promise. I keep saying that, but
Yeah.
I actually do have some that are coming up right now.
So you're not just dragging people along.
Yeah, this isn't going to be one of the big lies that we're putting forth. This is so let's talk about the first one, Brad.
Right. The
first one that I just had a patient that was just like this. The belief was that the spine is really delicate and easily injured. Actually, the spine is pretty strong and flexible. I mean,
if you just think about looking at athletes, how they get football players getting pounded every weekend, and not only that, or just look at when you see someone that goes through an automobile accident, and you think, how did they get through this without more injuries, particularly to their spine? You know, it is really. It's constructed incredibly well.
Yeah, it's a marvel. Actually.
It is.
I mean,
really
it really is.
is.
But I think it got to the point where this guy felt like if he did any movement at all, he was going to make it worse.
Sure.
And that made it worse, because if you don't move, your spine is going to get worse. I mean, movement is the key. You need to find the movement that you can do and keep doing that one.
Right, and avoid the ones that are irritating it. And that's what therapists, that's our job, is to help you figure that out.
Yeah, and at the end of this video, we're going to show a few things, like if you are in the acute phase, maybe you don't want to move too much during that day or 2 days. But once you get through that, we want to get movement as soon as possible. Number two, if I have back pain when I'm young, it's going to get worse as I age.
Yeah, this is...
A lot of people think that, don't they?
I remember I went to a back course. It was a 4-day back course, very detailed, and they pulled up a whole study showing that whole thought concept is wrong across the board, because what is it again? The
highest incidence of back pain occurs between 35 and 55. And a lot of times it actually starts getting better after that, believe it or not, quite often. I'm in the getting better age.
Right. Actually, so am I. I just turned 55.
So,
my back is actually improving. I guess maybe there's the only exception to that is osteoporosis, where when you get older, but that's not everybody. There's a certain people, and they're doing much better at preventing
You're really going to want to watch your posture as you get older and as you get younger, when you're younger. But just keep this in mind, and this is a theme we're going to keep drumming on, is the body wants to heal.
Right.
It's amazing how the body can heal if you let it. So don't get in its way. All right, number three, my father or mother had back pain and problems, so I'm going to likely have it too.
Right.
Do you hear that much?
Well, no, yeah, people think that, it's genetic, it's going to, but that's not true.
No, there's no genetic predisposition. It's just common. I mean, so I hear it all the time, because somebody goes, yeah, my mom had back pain, so I knew I was going to get it. It's like, that's not true. The thing is, 80% of the population, and I've even read as high as 90% of the population, has back pain bad enough that they actually miss work one day.
Throughout their life.
Yeah, throughout their life, at least one day. So that's a high percentage. So you're more likely to have a parent that had back pain than not. So and I had one. My mom has it, but my dad never had back pain.
Yeah, it's kind of weird, because neither one of my parents had back pain at all. And I've been dealing with it since I was in high school, but I had an accident, a wrestling injury and other things that compounded it.
The lifestyle you led, Brad, I'm not surprised you had more accidents.
I'm surprised
I'm surprised you're alive, is right. Number four, an MRI, I got to read my own writing, or other diagnostic test is needed to diagnose my back problems. I just had a patient like this too. I don't know why they're not doing an MRI right away. And the fact is, you want to come up with a successful plan based upon what we're seeing, try that, If that doesn't get better, then you go do the MRI.
Right.
And you did a whole video on this, Brad.
Right.
Where you
There's been I quote some studies, a really good study on this. The thing is, and another common saying in the medical community, and it's whether it's MRI or X-rays, is you want to treat the patient, not the X-ray,
right,
or not the MRI, because if you treat the scan, you could be missing big components that are a big part of the problem.
And that actually leads us to the next one, Brad. You know, let's say you have a scan, and they find an abnormality or back problem on the scan, and that needs to be cured. The fact is, they find lots of abnormalities on the scan that have nothing to do with your back pain. So I'm just going to mention this book. We mentioned it once before. It's called Paindemic, Paindemic. It's by Melissa Cady. She's a doctor of osteopathy. It's a good book. But what I liked is some of these statistics she gave. So what they did is these were people that had no back pain, but they did a scan on them. And just to give you, I'm not going to bore you with too many numbers here, but at age 20, they found 37% of the people had disc degeneration, but no pain.
The scan showed, yeah. And so, and they're living a normal life.
Right, right.
So you're not going to treat them for something that's not causing a problem.
And that steadily goes up as you get older. So let's just say our age, Brad, 80% of people have disc degeneration, but no pain.
Right.
So, I mean, what happens is, you know, I'll go in, I have back pain, they'll find disc degeneration. Oh my God, I have disc degeneration.
Right.
I got to have that treated. I mean, surgery or something.
Yeah, some injections.
Right. And the fact is that probably has nothing to do with it. It's probably more muscular or tendon or something else, or postural.
Something else. So it's.
And the same with disc bulging and facet degeneration. They had the same thing.
And this is just not one specific study. There's been numerous studies that support the same idea.
Yeah. So I'll put this book a link on our website. I'll have it linked down below. So, all right, where are we at, Brad? Number 7. A lot of people think that there's just one standard cure for most causes of back pain. So I got back pain. What do I do? What's the cure?
Right. We got to do this protocol of exercises or treatment, and I'll get better. But
that's not how it works. It's so complex, the back, that, and what you have is so many different disciplines that are in treating back pain. You have chiropractors, you have physical therapists, you have doctors, osteopaths, that they all have a different approach. And Brad, you made the comment before we even were discussing.
You could easily go to 5 different therapists and
physical
therapists and get treated with 5 different systems of back treatment, or 5 different chiropractors, and they all could treat you with a different protocol, so to speak. And the fact of the matter is, you might get better with all 10 of them.
Right.
Or there might be some that won't work, and other ones that you'll flourish on. It's really it's a back pain is a tough one in some ways.
One key to take away from that, Brad, is that if you say, "Oh, I tried physical therapy, it didn't work," well, you might do better by trying a different physical therapist. You know, I mean, you may not. I mean, but I'm just saying.
Get a second opinion.
It's going to be
different option.
Yeah. Number 8. When there's 10 of them, remember, rest is the key to recovery. And Brad and I did this discussion too. Yes, when you just hurt your back, you're probably going to want to not feel like jumping around or doing much.
If you're walking like this and it hurts, well, that might be a good time to take a half a day or possibly a day, but get a cold pack on it, get a comfortable position, and leave the inflammation settle down. But then you got to get moving.
You got to get moving. We're going to show you an exercise you can do just in a few minutes that you can do, you know, almost day 1, maybe day 2.
Yeah.
And then you also want to try walking as soon as possible.
Right.
I mean, especially if you can. And that kind of fits along with number 9 here, Brad. A lot of people believe, and this is an old belief, but I still see doctors that talk about it, is that extension is bad for your back. You want to show what extension is, Brad?
This is extension, as far as in the medical terms, this is flexion of the back. And at one time, back in the 1950s, everything was flexion. If you got a back problem, you got to flex and stretch those muscles out. And since then, particularly with Robin McKenzie, there's the whole theory and treatment method has changed dramatically over the last 50 years.
I've seen orthopedic doctors even say that you're not supposed to sleep on your stomach yet because that puts you into a little of extension. The idea is they think you're jamming the joints. But again, you spend your whole day doing bending forward things. You need to stretch it the other direction, and that gets the joints moving and lubricated and
right, as well as the disc.
As well as the
there's a lot
disc.
of biomechanics in the disc that are corrected that way. It just balances the system out, so to speak. We could spend, we have spent videos just talking about that.
And then number 10, long-term pain indicates that I need back surgery for my back pain. And this is, again, I'll recommend this book again. She talks about how she made this statement. It was kind of a bold statement. She said she's talking to other doctors and people who are in the pain management business. They wouldn't go near surgery, a back surgery, with a 10-foot pole.
Sure.
Unless you have such things as, a tumor or drop foot, or pain and weakness going down into the foot, because they're saying a lot of times you go in, you have the surgery, and now you've had the surgery and you're still not better.
Right, and those are the people that therapists oftentimes see that come out of surgery, it's not successful, and they're the ones that say, why did I ever go into surgery?
Again, we would never, ever say not to have surgery, because there definitely are instances, which I just had one recently. A guy came in and he goes, the doctor said to see you, but he goes, I really think I need surgery. He had drop foot already. He had pain. We tried extension. Nothing took it. I go, you're a candidate. And then he went in. He had a good surgery, and he's doing fine now. So
very quickly.
Very quickly.
Right.
Yes.
Yeah. If you've got that nerve is being impinged, we've got some videos on that too. But yeah, there are cases for it, but it's not the blanket thing. Surgery's the answer.
Let's just real quickly, Brad. Why don't you show what, like if on the first day of pain, what you might do.
This is one of my favorite things. For vast majority of people with back pain, we've found anecdotally in our clinics is this works well.
This is the leg wedge. We'll have this listed down in our Amazon products if you look down below in the description.
And if it's an acute pain, you just injured it, it's very sore. You're not going to put a hot pack on it. You're going to put a cold pack on it. After it settles down, you may go with heat. But initially, and Bob, in all honesty, Saturday, we were cutting trees down. I invited 3 other guys over, and we had a tree cutting trimming party. And after 4 hours, I used to be able to do that all day long. After 4 hours, I was walking a little crooked, a little painful. And I told the guys, I said, this is it.
You were done.
I just picked up branches lately after that. And that night, I went in this position, and I was sore. And I actually fell asleep like this on the living room floor. But I woke up at noon or at midnight, went to bed. The next day, 90% better.
See,
I was so happy.
Yeah, 2 things you should take away from that. 1, he knew when to stop.
Right.
And then 2, he knew what to do. But the next day, he got moving right away.
Right.
So,
the pain had settled down. I was walking, and I did not go back out to cut more trees down. I had a normal, calm day.
So 2 movements that generally we try to get people to do right away. 1 is rotations.
Right.
This is just a great one. If it hurts in one direction, don't do it. Just go the other direction.
Right. So if it hurts going towards the countertop, I'm just going to go the other direction and work it there. And oftentimes you'll find you do that a few times, going back the other way, it'll loosen up a little bit. But listen to your body. Don't use the philosophy, no pain, no gain, because that's not going to get you anywhere with back problems. You want to find the motions that feel comfortable.
You want to pop up real quick, Brad?
Yes.
I'm going to show one real quick. I'm going to show one last one real quick. We've been running way over here.
Oh my gosh, Bob.
Again, the other one that you want to try to do for most people is to try to get some extension going.
Sure.
Some extension movement. So you're on your stomach. You're keeping the pelvis down. You're not lifting up like this. And you're just trying to get some more movement, and eventually get up to here.
There you go.
So we got whole videos on that. But all right, let's call her in. Thanks.
Yeah,
Thanks everybody for watching.
Everyone's clicked off by now anyways.